Will be in the periphery, and in fact you can see, if you're looking on the floor, you can see the mock-up of where each room is going to sit. And if you want to come this way, you're literally walking down a corridor and you might be entering each individual room here. So please come on in and take a look at one of the units that has been mocked up for us. If you come on and come with me, you'll get a good look at what you can envision a real hospital room will look like in the pediatric intensive care unit. So as you come into the room, I think one of the first things that you see is this boom here. That's what we call it. And what it really is a way of producing outlets for multiple different electrical outlets. There's medical air, oxygen, and suction that are all on this unit. And the nice thing for us is that we don't have one hanging down in the middle of the room that people can bump their heads against. And the other thing we don't have is a wall unit where everybody's reaching and scrambling to get various cords untangled. It's movable, as you can see. And it's really very nicely identified. It's a little bit squeaky right here because it's just a mock-up unit, but you get at least a little bit of an idea of what this might look like. The bed for the patient will come out right this way, and there's lots of room for physicians, nurses, other allied healthcare professionals to be around these critically ill patients. I think the other thing that I wanted to point out is the spaciousness of this room. Each one of these rooms literally is twice the size of the ones that we currently have. We even have a wonderful area where families can congregate, a place where parents can sleep. There's a place for the child, if able, to watch television or video games. We also have, I think, a wonderful area for our nursing staff to do their charting and to be able to watch not only one patient but two patients, because there's an adjoining nursing area here for the room that's on the other side of this wall. I'm wondering if you have any questions for me.
How important is Children's Hospital to the community?
Well, we think it's quite important. I mean, if you look at the raw numbers, we see children from about 38 counties in this state. We're the northernmost academic medical center here in the state, so we see children, as I said, from those counties, as well as western Nevada and southern Oregon. We see about 6,500 admissions per year. The pediatric intensive care unit, which will be here, is admitting more than 1,100 children every year. So we see really the sickest children who are sent to us for a variety of different reasons, and because we have more than 120 physicians in something like 20 different specialties who can care for them. Are there any other questions?
Oh, yes, I have one. How much funding do you receive from the state?
Well, technically speaking, because we're the University of California, we do receive state funding for the salaries for the doctors who act as teachers and researchers. It is about 5% of our total budget, which you might think is small. It's actually very large in comparison to some other states, but it's really only 5% of the monies that we need to perform all the functions that we do here every day. Are there any other questions?
Yeah, Dr. Phillips, how will Children's Miracle Network help the PICU project?
Well, Children's Miracle Network actually is helping the PICU project as we speak. We've raised over $1 million to go for some of the building and construction on this wonderful unit, and we need another $1 million to go. We've pledged $500,000 this year, and for the following year that will complete our pledge. So it's a major, major gift from the community, and we're very thankful for any support that we can get. Are there any other questions?
Yes. What other types of projects do the funds we help raise support?
Well, I'll tell you quite a few. For many years, the Children's Miracle Network in our community has raised funds for all different kinds of projects, and they include things like bicycle helmet safety, infant car seats, just to name a few of the actual mechanical projects, if you will. In addition to those safety items, the Children's Miracle Network has also raised money for specific pieces of equipment that are exclusively needed by children. They include things like endoscopes, these little tiny telescopes that can look at the insides of children and tell what problems they might have. We also have raised money for sudden infant death syndrome research, and particularly equipment that can be used to identify children who might be at risk for what's called apnea. In addition to those kinds of mechanical things, though, Children's Miracle Network in our community has raised a lot of money for a variety of different research projects having to do with diseases that afflict children, everything from cancer research to kidney problems in children, and everything really in between. It's just a marvelous use of the funds, I think, to do all kinds of things to help the children in our community.
Yeah, this is cool.